I'm Wayne Damon on the Legends, 1450 WNBP. Well, it's time for our monthly visit now with Bob Keller, new report certified myokinesthetic specialist.
You're getting very good at that, Wynn. Thank you very much. I'm glad to be here.
Oh, it just rolls right off the tongue now.
Right.
I've been up all night. But yeah, Bob's, gosh, you're a regular now, aren't you?
Absolutely.
Yeah, that's very nice.
Long time.
And for those who don't know where Bob's practice is, it's at the Meridian Body...
Meridian, my dear.
See, that's it. The Meridian. I've been so concerned about myokinesthetics. But the Meridian Body Therapies building, that's at 166 Water Street. And it's right down the Joppa Flats, right?
It is, just before Joppa Flats.
Just before Joppa, okay. And you have brought a guest with you.
I have brought a guest, Lori Drogue, who is not only an outstanding therapist, but also a friend and colleague, and partly for my purposes this morning, she's the founder of Meridian Body Therapies, which sort of rolls off your tongue from time to time, but nobody ever knows what it is.
Yeah.
So I brought Lori to have her tell us a little bit about Meridian, for starters.
Now, I've been by many, many times, and I was said, what's in there? Lori, what do you do?
I've been a practicing massage therapist for a little bit over 20 years now, and in 1994 began working out of 166 Water Street, where a former colleague and I had founded what was Sports and Therapeutic Massage, and I renamed and dedicated the practice in 2001 as Meridian Body Therapies.
All right. And I'm sure you've taken care of many, many people in between, from the start to now, huh?
Yes, I'm sure thousands. In fact, I know thousands.
But what Lori did not emphasize is that the way she has built the place, it is truly a place of peace and healing. If you haven't been there, even if you don't come for a treatment, stop into the waiting room sometime. See the pictures, the 166 art gallery, and just take a minute to be away from the world. I think you'll enjoy it.
Is it really true that you can think better if you slow yourself down?
I can.
Yeah.
I can. I believe that firmly. I think one of the things that still is a myth about so-called relaxation massage is that people are underestimating the benefits of what relaxation does for the body. There are many physiological benefits, which I won't go into at this moment, but to say that it slows our nervous system down, and we all know when we're more relaxed that we won't be as tense and as nervous and have as much blood pressure, for instance. Reduced blood pressure is one benefit of slowing down.
Mm-hmm.
So as Bob was saying, I like to think that that begins even when somebody walks in our door, that they come in and they see beautiful plants, they see lovely colors, they see cleanliness, and they have a sense of peace before they even get on the table for their treatment.
Oh, that sounds very nice.
So, as you are well aware by now, my job is to focus on the nervous system and specific aspects of the nervous system to relieve a wide variety of pain. In addition to doing general therapeutic massage, Lori also does what's called Cranio-Sacral work, and I'd like you to just say a little bit about that.
Cranio-Sacral?
Cranio.
Cranio.
Very good, Wynn.
Okay.
Cranio-sacral, cranial as in cranium, the head, and sacral as in the end of our spine, or our tailbone area. So the name itself comes really from defining the anatomical boundaries that are most specifically involved with craniosacral therapy. It's a therapy that I spent about 10 years training in through the Upledger Institute in Florida, which was begun by Dr. John Upledger, who's the most prolific teacher in this country of craniosacral therapy. Its primary benefits are wide-ranging because, similar to Myokin, not in treatment but in theory, is that it can address a wide variety of issues that are concerned with our central nervous system. So, for instance, I'll see newborns who may have had a difficult birthing experience. They may be suffering colic or having trouble eating well, as well as older folks who might be experiencing chronic pain. Those are a couple of the areas.
So your two practices, they go together.
Well, that's one of the things I wanted to have Lori here for, is to just talk about, I mean, we each refer to the other. And I just wanted to sort of zero in on what circumstances I would refer somebody to Laurie, which I do fairly frequently. As I said, my job is to work on the nervous system and getting the nervous system to reorganize your body, to relieve pain, to relieve numbness, and so on. But if your muscles are so tight, if you are so anxious, that your central nervous system doesn't stand a chance of reorganizing, they need Laurie to do a general therapeutic massage to get rid of some of that stress, work on specific muscular issues, and in some cases even the cranio-sacral work.
So Laurie, so you'll calm the body down, and then Bob, you go in and you retrain the body.
Something like it. Very good. Yeah.
Okay.
That can be a general sense. I think for Bob, when I would refer to Bob is, for example, a tendinitis is something common for many folks. So for me, if somebody has come in with a few complaints, but in general maybe they're seeking overall balance in their lives and stress reduction, I have an hour or an hour and a half to deal with many different things that might be going on for them. And if they come in with an elbow tendinitis, for instance, I might say, well, I need 20 minutes out of our hour session to deal with that. I have a colleague, Bob Keller, who practices Myokin, and he can really target in and exclusively work on just that area. And you can go for more frequent sessions because the duration of the sessions are less long, and it's something that you could fit in, say, on your lunch hour, and where for me we're focusing more on other areas of the body which could be playing a role in the specific issue, but again, Bob can deal with that in a more specific manner.
It sounds very interesting, and it sounds like you two work very well together.
So far, so good.
Yeah. All right, so that's the over at the Meridian Body Therapies building at 166 Water Street, Newburyport. And what's the street that goes up?
Bromfield.
Bromfield, okay. All right, I always get confused down there. So, all right, so the people know exactly where it is, and that's I like that. I like that that approach where the two of you can work together.
Mm-hmm.
I really enjoy having Bob there as an adjunct because people sometimes we all adjust, even when people begin a new practice, whether it's a yoga session or Pilates session for strengthening or some type of body work. If they do the same thing for a long enough period of time, even good habits can become patterned in our bodies, and it's always good to have an option to change up what they're doing so that it gets their nervous system to pay better attention, and they have an opportunity to shift things in a direction they'd like to move in.
And your first treatment, when they go see you, you kind of analyze what they're all about, right?
Absolutely. The first treatment is usually around a half hour. Subsequent treatments are 10 to 20 minutes. But during that first time, we talk a lot, and I often will do a posture analysis because your posture tells me everything I need to know about your nervous system and what's going on with it.
Let's straighten up here.
By the way, Lynn.
All right, well, thank you very much. So 978-465-5111, that's the number to call for Bob Keller, and he's the Newburyport Certified Myokinesthetics Specialist. All right. Hey, Laurie, thank you very much. It's a pleasure meeting you.
Thank you, Lynn. It's been a delight.
And Bob, thank you for bringing Laurie in.
As always, I'm glad to see you, and I'm grateful to Laurie for being here.
All right. Laurie drove from Meridian Body Therapies at 166 Water Street, Newburyport, at the corner of Bromfield, and Bob Keller, Newburyport Certified Myokinesthetics Specialist. Our guest this morning here on The Legends, 1450 WNBP.